HMRAlert, a widget allowing GPs to send home medication review e-referrals, has been installed on your computer. A bell icon should now be visible in your computer system tray. If not visible, you may have to expand the tray contents by clicking on the arrows to view it. If the icon is not there, please let the practice manager know, and they will contact us to check your instance of the installation. Before HMR can be used, the widget has to be set up to activate. Otherwise, it will just sit there dormant in the system tray and not do anything. To set up, double-click on the bell icon. This will fire up the HMRAlert form. You know HMRAlert is still in setup mode if it says setup and the status is unregistered. Click Next to begin. Select your account name from the list. Read the terms and conditions and click the checkbox to accept them. Confirm that you have picked the correct name from the list in the previous step. Update any details if incorrect. And click Finish to complete. It may take 10 to 20 seconds to register. Done. HMRAlert is now set up and active. Click Close to minimize the form. To check the HMRAlert setup status on any computer, double-click on the bell icon in the tray to display the console. HMRAlert is set if it is connected and the registration details are set. In the unset mode, this will display as unregistered. Close to minimize. Now that we are all go, let's see HMRAlert in action. When a patient enters the consulting room and you open up their clinical record, HMR will check its settings against the patient's medical profile. Configuring these settings are covered in detail in another clip. If a match occurs, a pop-up will be displayed detailing issues that the GP may want to consider and whether to recommend an HMR. The GP needs to assess the patient for clinical need. The GP can decide not to refer, or to disable the alert for this patient. Don't refer means cancel the alert, but alert again the next time the patient's record is opened. Disable alert means cancel the alert and do not alert this patient again for at least another 12 months. Send referral means, well, send referral. For the demo, we will conclude that there is clinical need and issue a referral. HMR will compile the e-referral in the background. This may take 5 to 10 seconds, and then open the Send Referral form. To compile and issue the HMR e-referral, the GP must specify clinical need. Check one or more of the default needs, or type the details in the other text box, or both. The GP can provide additional note to the pharmacist as well. When all done, press the big orange send button to send. Before we send, however, We'll take a quick tour around the form. 2 is the pharmacist that will receive the e-referral. This is set by default for the whole clinic, but can be changed on a referral by referral basis. The referrer is the referring GP, which will default to you, but can be changed so the referral can be sent on behalf of another GP. The urgent checkbox will inform the pharmacist that the HMR referral has a high priority. When all is good, press send. HMRAlert will encrypt the e-referral and email it to the pharmacist. An alert for this patient will not occur again for another 12 months. If you are finding that HMRAlert is firing needlessly or too often, or if HMR is missing high-risk patients, you can change the alert configuration independently of the other GPs in the practice. Double-click on the bell icon in the system tray to access the alert settings. The default medical history settings are listed here. To remove, double-click on one of the items. To include another medical condition, type in the text box above and select from the list. The clinical systems have a hierarchical structure to medical condition classification. For example, by including malignant hypertension, the patient with these conditions in their profile will cause the alert to fire. If we select the more generic hypertension term, you can see that the inclusion of this condition has a much broader reach. The drug alert criteria works in much the same way. Double-click on an existing drug class to remove it from the alert criteria, and search an ATC classification and select to include the drug class in the alert criteria. Note that HMRAlert captures drug class by ATC grouping, not by individual product or brand. That concludes the instructional video. I hope it all makes sense. If not, please talk to the practice manager or contact me directly with any questions. Thank you for your time.